All right, that was kind of a goofy video, but I enjoy watching that because it does a good job of explaining how we end up with clots. So in this chapter, we're going to talk about 4 different classes of anticoagulants, and they are discussed on pages 267 and 268. When we talk about anticoagulants, lay people refer to them as blood thinners, and even doctors and nurses, you'll hear them calling them blood thinners, and that's actually not the case. They do not thin the blood. They will not dissolve clots that a person already has. What they do is to set up a situation where the clotting factors are affected to where it takes longer to form a clot. So what we want to do with anticoagulants is we want to stop any more clots from forming, and we want to keep the clots that are already there from getting larger. So the categories of anticoagulants that we will talk about, starting on page 267, are what is known as platelet inhibitors. Notice this is in red. Aspirin is the most commonly used antiplatelet drug, but there are other stronger platelet inhibitors that we will talk about. And then we have drugs known as direct thrombin inhibitors. They interfere with factor II, which controls the action of thrombin on the rest of the clotting factors, and you will recognize these drugs as being newer drugs. Some examples are Pradaxa and Eliquis, and these are new enough to still be advertised on TV. They tend to be kind of expensive. And then we have drugs that you're already probably familiar with. These are indirect thrombin inhibitors. They don't directly affect thrombin itself, but they increase the action of a factor called antithrombin 3, which indirectly leads to thrombin no longer being as quickly available in the clotting cascade. It kind of slows things down a little bit. These drugs are the heparins, which have been around for quite a long time, and also what we call low molecular weight heparins, which one example of this would be Lovenox, which some of you might have had a chance to give in clinicals. If you look on page 267, we see that we have table 14.1, and it gives a list of platelet inhibitors, a list of the direct thrombin inhibitors, and the indirect thrombin inhibitors, such as the classic heparins and the low molecular weight heparins. And we'll talk about each one of these as we go. The last anticoagulant that you might see commonly given is discussed on page 268 of your textbook, and these are drugs that interfere with vitamin K. Vitamin K is a very important part of the clotting cascade, and vitamin K has to be present in regulated amounts to allow the clotting cascade to go. One of the drugs that blocks vitamin K from reaching that clotting cascade and allows it to not be as readily available is the vitamin K antagonists, and warfarin or Coumadin is probably going to be the most common one of these drugs that we will see. So starting on page 268, we see that the first drug we're covering are the platelet inhibitors, and probably our most commonly known platelet inhibitor is the drug aspirin. We have talked about aspirin in other situations, but what they do is they work in the clotting cascade to inhibit platelets from aggregation or clumping together. Platelets are sticky, and when they run into each other in the bloodstream, they stick together. When we fall down and skin our knee and blood and other factors are oozing out of that scrape, as the clotting cascade regulates it and a thrombin or a fibrin clot is formed, those platelets all stick together, and that manages to form a covering over the wound, and that it will eventually harden. So in this way, they reduce thrombi from forming. So platelet inhibitors are often used to help keep blocked blood vessels open, to keep any venous or arterial grafts, things that we've put in veins or arteries, to keep them open, and to prevent strokes. So one of our first drugs that we're going to be talking about is just plain aspirin. The chemical name for that is salicylic acid, or you might see acetylsalicylic acid, which is called ASA. Aspirin is often used to reduce the incidence of MIs or MI-related deaths in men over 50. It's directed at men over 50 because that's who the original study was done on. It's the drug of choice to prevent ischemic stroke. And if you remember when we talked about the cardiovascular system, ischemic stroke was caused by a blood clot blocking access to oxygenated blood, as opposed to a hemorrhagic stroke where there was a tear or some kind of wound in the artery itself. It's always important when you're dealing with aspirin to watch for the adverse effects. Sometimes a person will bruise very easily. They'll have petechiae, which are little pinpoint hemorrhages. Tinnitus, the ears will ring. Sometimes that's the first sign of there being too much aspirin in the blood. Black stools will sometimes be noted. We always want to avoid taking aspirin and NSAIDs together because they can be very irritating to the stomach alone, and when you put them together, they're even more dangerous and increase the risk of a GI bleed. An aspirin allergy is fairly common, and itching and hives can indicate the beginnings of an aspirin allergy. This is a really good picture, I think, of the different side effects of aspirin. You can see very common side effects: nausea, stomach pain, heartburn, and vomiting from taking too much aspirin. And the side effects in the red are really more adverse effects. They can cause swelling of the oral mucous membranes. Eventually, a person can have difficulty breathing. They can break out in hives or a rash, and all of those things indicate the possibility of an allergic reaction that could lead to an anaphylactic reaction. And in extreme cases, they can cause GI bleeding. If it's GI bleeding in the stomach, you'll see emesis with actual frank blood in it, or if it has had a chance to age a little bit, the person will vomit something that resembles coffee grounds. In the colon, you'll sometimes see actual bright red blood in stools, or if it's been in there a little bit longer, the stools will appear black, or what we refer to as tarry. They'll look like something you'd treat a driveway with. All of these indicate a problem, and the aspirin should be held and the healthcare provider notified. I'm going to stop right here because this part of the lecture is getting a little bit longer, so I will stop and download this.